we approach when we approach the JDRF, and especially Dick, who is the Chief Scientific Officer of JDRF, I mean, the welcome was extremely warm, and we immediately agreed that indeed we should partner because actually we have the same goals. You have, you know, really patients at the core of your activities. So I would say that this partnership was natural and that the organization of this meeting, I must say, went quite smoothly. We will see at the end, but I'm quite optimistic. So what I would like to say is that our hope is that during the meeting, really the patient voices are expressed. We have many important players, especially in IMI, especially from industry. So this provides you a unique opportunity to show to our industry partners, to the pharma companies, what can be achieved through this multi-stakeholder collaboration with the active involvement of patients. So unfortunately, John Bowis will not be with us today because he has some actually health problem, nothing dramatic, but which prevent him to travel. And I'm very grateful to Adrian Sanders, who is the president of the Global Network of Parliamentarians for Diabetes, to have accepted not only to chair the last session of this meeting, but also to provide us with concluding remarks, because it's very clear that we need this political support. Adrian is a member of the UK Parliament, but he has a worldwide influence on diabetes research. So this will come at the end of the meeting. So without further ado, I will give the word to Dick Insel, Chief Scientific Officer of JDRF International.
Well, thanks, Michel, and it's a pleasure to be here. And on behalf of JDRF, I want to welcome all of you to this patient-focused meeting. I would be remiss if I didn't acknowledge all the logistics work that came from IMI, and I want to thank Michel and Magna Gun and Ava for all the hard work that they did in putting this together. On our side, Olivier Arnaud, who is our JDRF European Director, and Jill Clark, who heads up our international affiliates, are in the audience and really did the yeoman's work in setting this up for JDRF. As Michel points out, this was an easy meeting to plan because we are highly aligned with IMI. And I believe that this meeting is really quite important and quite critical, not just for IMI, but for all of pharma innovation and for pharma innovation to be successful. You heard from Michel about IMI. I just want to take a moment to explain what JDRF is and what it's about. And as you heard about IMI, the patient is centric to JDRF. In fact, JDRF was founded over 40 years ago by parents who had children with type 1 diabetes. In a very bold and I would say prescient manner, they may put a stake in the ground. And what they said is, we want to remove diabetes from the lives of our children. In some ways, possibly a naive statement, but it's the kind of bold statement, it's the kind of aspirations that patients and loved ones of individuals with type 1 diabetes have said in the past, are saying today, and will continue to say in the future. They want their lives to change. On one hand, we realize a cure for which we remain steadfast in our approaches at JDRF. We'll continue to pursue a cure, but on the other hand, we realize a cure is not at hand. And so what we're hearing from patients, and I think you'll hear that today, is prevent the next generation from developing this disease. In addition, keep us healthy while we wait for that cure. Remove the burden of living with this disease, this daily burden, the daily challenges, the 24 hours, 7 days, 365 days a year, faced with uncertainty, fears, decision making. It's a tough life. Help us in that regard. And this is where the voice of the patient is critical. We at JDRF have that voice of the patient with respect to our board members, our board committees, and we have even formed a Type 1 Diabetes Voices Council comprised of individuals at all ages and stages of Type 1 diabetes, as well as their loved ones, including siblings, parents, grandparents, and children, to make sure to provide feedback to JDRF, to make sure that what our priorities, our focus is attuned to what individuals with this disease and their family members need. Today, JDRF is funding over $100 million of research annually around the world. We're funding research in 17 different countries. Approximately a third of our research is outside the United States, and over half of that research outside the United States is in Europe. All of that research funding is funded based on the eyes of individuals with this disease in making sure that that funding is aligned with their priorities. Today, the patient, individuals with type 1 diabetes and their family members serves as a compass for JDRF. And I think it can serve as a compass for IMI and IMI2 and for the diabetes efforts around IMI2. In closing, I just want to mention two coordinates on that compass, which I think will be major themes at this meeting and will help frame this meeting. The first coordinate is what I would call the value proposition, making sure that we're bringing value to individuals with type 1 diabetes and their family. Are we delivering therapies, or are we delivering therapeutic solutions? Are we delivering incremental improvements, or are we delivering truly impactful, innovative developments? In the trials we conduct, we need to ask, what's in it for the subject? How is the subject made to feel special? Do we solicit input on the practicality of trial design, on enrollment practices? Do we provide context for studies? And do we provide feedback on the results of those studies, whether they be positive or negative? And the second and last coordinate is what I would term participation and partnering. We need to continue to empower individuals with type 1 diabetes and their families, have them participate as true partners in the research enterprise from its beginning to its end, sharing their experiences, sharing their data, weighing in on what's desirable, weighing in on what's important, weighing in on what's acceptable, participating proudly in research, driving trials to the right stratified subjects, rather than thinking about how we have to drive subjects into trials, and providing patient-reported outcomes of research, and providing their concept of benefit risk to regulatory agencies and providers. That voice of the patient has provided a compass to JDRF, and as I said, I think it can provide a compass to IMI and IMI2. And if we use that compass, I am convinced we'll move in the right direction and will deliver on that promise in a timely manner. Thank you.
So since we told you that we want really to put patient at the center also of this meeting, we will immediately start with the patient's experience. Perhaps you can introduce our first two speakers.